Good morning, Furious. Today I'm not going to have any PowerPoint presentation as such. I'm going to talk. So, disclaimer முன்னாடியே போட்டுறேன், யாரையும் பயமுறுத்துறதுக்கு இல்ல. Just ஒரு எல்லாருக்கும் ஒரு awareness-காக தான் this talk is about. So, what I'm going to talk about is mouth is your body's early warning system. Today I'm going to talk about that. So, mouth is your mirror of your body. என்னெல்லாம் தெரிஞ்சுக்கலாம்னா மவுத்தில் என்னெல்லாம் ஃபஸ்ட்டு தெரிஞ்சுக்கலாம்னா எனி டிசீஸ் ஆஃப் யோர் ஹார்ட் டிசீஸ், கிட்னி டிசீஸ், லங் டிசீஸ், யுவர் விட்டமின் B12, எனி விட்டமின் டெஃபிஷியன்சி, ஹெச்ஐவிஸ் எதுவாக இருந்தாலும் உங்கள் மவுத்தில் ஃபஸ்ட்டு கண்டுபிடிக்கலாம். ஒன் ஆஃப் மை காலேஜ் ஃப்ரெண்ட், she had leukemia, which was found during a regular scaling checkup. It was found that she had leukemia because of the spots in her gums. She was diagnosed of leukemia and we were able to treat her. Unfortunately, after a few years, because of leukemia, she is no more. But still, we were able to prolong her life because it was early detected because of the signs in the oral cavity. So please do not neglect your oral cavity. And which is the hard part of your body? Can anybody answer that? Specific is your enamel in your teeth is the hardest part of your body, and any hard part of your body, even in your bone, can be regenerated, but your teeth cannot. The enamel cannot be regenerated. Once it's gone, it's gone. So you have to be careful. Enamelé போற அளவு ஏதாவது நடக்குதுன்னா அப்போ வேற ஏதாவது பாடியில் ஏதாவது நடக்குதுன்னு அர்த்தம். So we have to be careful that we should protect our enamel and our teeth. So என்ன இந்த enamel ஹார்டாக இருக்கும்போது அந்த decay வருது. அந்த decay is destroying the enamel. So that means the decay has the potential to do something more also. So what are the contributing factors for this decay are your sugar intake, your processed food, and the time factor. In the sugar intake, நம்ம சாப்பிட்டு brush twice we have to brush, and every time you have your food you have to gargle. So what happens is immediately the sugar is washed off, or the sticky food whatever is there is washed off. The time factor என்னன்னா ரொம்ப நேரம் நைட் ப்ரஷ் பண்ணாமல் நம்ம படுக்கிறோம். நைட்டு ஃபுல்லாக அந்த சுகர் அந்த மவுத்தில் இருக்குது. அந்த கேவிட் எல்லா டூத்தும் எப்போவுமே பிளெயினாக இருக்கிறதுல there are ups and downs in the teeth and the grooves. The sugar stays there. Once the sugar stays there, it creates there are oral cavities. There is a normal commensal bacteria. That means the bacteria is already there. The sugar or any other sticky food is just the feeding substance to that bacteria, and the bacteria has that and produces acid which destroys the enamel. So it is not that the bacteria is coming from outside, it's already there, just that we are providing food to it. And the food நம்ம வந்து எப்படி ப்ரஷ் பண்ணி எடுக்கிறோங்கிறதா நம்ம கையில் இருக்குது. What we can already do it, always do it. So reduce the time which the bacteria can have food, and then clean away the food. And the second and the other important thing which we can do is the sugar statistics. What average Indian can anybody tell me what an average Indian consumes in a year sugar? It is around 18 kgs we consume. You might think that I'm not having sugar in my coffee, tea or anything, but you're having sugar through your processed food, your soups, everything there is sugar. There are 61 different types of sugar in what we have. It is not that நம்ம லேபிளில் சுகர்னு போட்டால் மட்டும்தான் சுகர்னு கிடையாது. There are 61 types of sugar. How do you know that there is sugar? The only way is to memorize the number of the list of sugars. And definitely the boxல பார்க்கும்போது the packaging contents, the top 3 sugar இல்லாமல் இருக்கிறது. It's not that we can totally avoid sugar. The top 3 sugar இல்லாமல் இருக்கிறது, it's very important. And reading labels and the different types of sugar we should see, and the top 3 இருக்கக்கூடாது. And try to avoid processed food. And the other thing is the chewing. The most important thing to chew is the enamel again. Chewing, the whole digestion process it doesn't start with your stomach, it starts with your oral cavity. The food has to mix with your saliva. It has to be chewed at least 32 times before you swallow. There is a specific way to swallow it. அதாவது 32 times swallow பண்ணோங்கிறது, it is a research based study. 32 times chew பண்ணிட்டு அப்புறம் swallow பண்ணு. That means it becomes a bolus. கூழ் மாதிரி ஆக்கி நம்ம சாப்பிடணும். அப்படியே முழுங்கிறதுனால என்ன ஆகும்? The acid produced in the stomach is unable to digest it. So we get a lot of disease. One of the major diseases of not chewing the food is diabetes. Diabetes has its own implications. The main implication of diabetes is your oral health again. Diabetes வந்து ஒழுங்காக சாப்பிடாதனால டயபெட்டிஸ் வரும், chew பண்ணி சாப்பிடாதனால. டயபெட்டிஸ்னால again loosening of teeth, multiple abscess in the gums எல்லாமே இந்த டயபெட்டிஸ்னால வரும். It is vice versa. And இந்த abscess வரதுனால again diabetes increase ஆகும். Diabetes is like a cycle. நம்ம எது பண்ணாலும் இதுவாகும். So it is our time to take care of our oral health, and it is our part of the body to take care of it. Have you seen any teeth walking alone without its body to the dental clinic? I haven't seen any tooth coming alone. It always comes with the owner. So it is our part of the body. So we have to take care of it like any other system in our body. So thank you. That's the whole thing. I just want to create some awareness about our teeth and the whole system which is associated with.